What's up, guys? Dr. Mo here, digital nomad physician at digitalnomadphysician.com. This is Bend, Oregon. Welcome to the fourth house that we're in. My wife's going to be doing this gig for a little while, so we're going to be in Bend, and I really like it. I'm actually loving Bend. Let me see if I can show you guys the outside. Can you guys see this beautiful outside? There's a giant park in front of us. I mean, it doesn't get any better than that. All right, let's see. How can I make it so you don't see my messy shit in the background? Okay, so guys, today I'm going to talk about cash-based medical care again, but I want to talk about why right now, there's no better time than right now to get into a cash-based medical system of some sort. So health insurance is becoming more and more expensive. The health insurance financial incentive has grown so big, and there's so much financial motivation behind it. There are so many politicians who are lobbying on the behalf of insurance companies for good and bad reasons. I think health insurance is quite helpful. We'll get into that in a minute. That it's only going to grow. So health insurance is going to have its tentacles inside of healthcare more than ever before. And it's not going to change anytime soon. Health insurance is not going to get any cheaper. We're going to see some new health insurance products come on the market. They're going to be limited to the kind of people who can get them. And I think it's really good that right now we have this expanded state health coverage, but that's also kind of disappearing. There is this sort of movement towards that you guys already know if you live in the US. So access is going to drop. Access is going to drop. Health insurance is going to become more expensive. Things are going to become a lot more opaque. And as always, when these things happen, we're going to see two divides. We're going to see the kind of the disappearing middle part of the population who was kind of getting their access, kind of getting their screening, kind of getting their colonoscopies, and that's going to shrink big time. And we're going to have this large population of people who are wealthy, who have the means, who have high health literacy. They pretty much know what it is that they're going to need. And then we're going to have a very big population that used to be in the lower end of the spectrum. And then the people in the middle are mostly going to fall into this category where access is going to be limited. Health insurance denial is going to increase. Their overall health is going to go down, even though they're having a lot more kind of not so great access. So as a cash-based physician, you can come in this space and you're only going to be able to service the rich, but you're going to only be able to service the rich. You can still service the people who have lower health literacy, but the problem with lower health literacy is you're not going to convince somebody that this medicine, this treatment, this surgery is not good for you. This is going to make you so much worse. That's going to be very difficult to do because this group is also much more likely to take the cues from social media, somebody who's very charming, who's online, who's got a great presence. They're going to believe you need more protein, I need more advanced testing, I need more medications, and that's what's going to get me better. And while this group is going to be the most profitable for the health insurance industry, they're not going to be very profitable for the kind of physician who's about lifestyle management, habits, long-term care, long-term health. Those are the things that a lot of physicians are kind of interested in. And I'd say more nurse practitioners than ever before, but I think that's going to dwindle out too. I think a lot of nurse practitioners right now are entrepreneurial, they're excited, their states are letting them run their own practice. But I don't think that's going to keep up because health insurance-based care or mainstream medical care is going to want a lot more cheap labor. So we're going to see a lot more nurse practitioners, probably somebody under a nurse practitioner, and then we got PAs, we got CNAs, LVNs, LPNs, MAs, did I say CNAs? And then we got RNs. So I think that's going to grow because we're going to be able to bring in more technology, more AI, and that's going to service the majority of the people here at the bottom end. And again, their overall outcome is going to be worse, of course, because that's what healthcare sells. Healthcare sells you a product and a service, not for you to become better. They're selling you a product and a service. It's like a bag of chips. They're selling you pleasure. They're not selling you food, right? It's not food. And there's nothing wrong with having it if you probably know when to have those chips. Like bag of chips lasts you a month. But it's difficult. It's really, really difficult. And for the people here in the bottom, it's going to be way more difficult in the future because now technology, medications, medication approvals, all of that is going to become the fact, is going to become like, hey, this is what you need. You need more care, you need more interventions, you need more testing. That's what's going to keep you healthy. While the people in this group are going to say, let's see, we're spending more money on healthcare and the average American is getting sicker. Everybody should be on statins according to all these new tests and algorithms, and yet everybody's still having more heart attacks. Okay, so that's not what I'm going to do. I'm going to see what I can do to prevent this heart attack thing, because I want to live to see my grandkids. I want to live a little bit longer. And I know that stage 4 cancer is not really treatable. Yes, there are miracles and miraculous recoveries and things, but it's, not, the chance of it is very low. So what can I do as an educated, informed healthcare consumer to stay out of this engine that's the healthcare system that doesn't want me to be better, doesn't want me to be healthier? They wouldn't benefit or profit. And if they did or could, they would probably deny my care right off the bat. So they're going to go into lifestyle medicine, preventative medicine. They're going to go into, yes, some advanced testing, but probably even less testing because they realize that tests are there to pick up disease. Tests are not there to rule out disease. That's the way tests are designed, unfortunately. And they're going to realize that when the FDA approves a bunch of medicines, they don't really care how to get people off of medicine. They just want you on a medicine and you stay on that medicine. I'm not saying that's the way things should be. It's just the way I understand health to be. If you're fortunate enough, lucky enough in your 30s and 40s to not have had a lot of chronic diseases, staying healthy, you're pretty much swimming upstream because the food system is stacked against you, the air pollution, food quality, water quality, stress levels, all of that is stacked against you. Now, if you want to, in America, it's probably one of the easiest countries to maintain good health, good sanity, good all of that stuff. But it comes at a major sacrifice. You're going to have to sacrifice your paycheck. You're going to have to sacrifice your lifestyle. But these are the people who are willing. And if you're a doctor, if you're a family medicine doctor, internist, cardiologist, spine surgeon, if you're an endocrinologist, gynecologist, you have the ability to offer your services to these individuals. And while maybe you believe that, yes, but in the insurance system, I can get $140, boom, cash, easy from Medicaid for just doing a quick pap. Actually, a lot more than 140. But just to see somebody for pelvic pain, for GSM, is it GSM? I forgot. Genital, maybe, whatever. You're like, okay, but I can see like 4, 5, 6 of those in 1 hour. And then I can have my PA see like 12 more. There's so much more income. There is more income, but that's going to dwindle. That's going to dwindle majorly, and you're going to start competing with AI, and AI is going to take, not over your job, but AI is going to take some of that work, and your job is going to become babysitting AI, and that's just not pleasant. Now, if you change that over and you're a gynecologist, you're an obstetrician, and you're working with somebody who has the means to pay, and this is, by the way, these are not very rich people. This is somebody who can afford to pay $5,000 for prenatal care. That's not a lot of money because the people down here, yes, they're not paying the $5,000 for prenatal care. Their insurance is covering that, but they're paying 8 times that in the long term due to their obstetric-related health issues from their kid all the way to themselves. And so that cost is hidden because it's in the future. And if you explain to somebody like, hey, I can keep you healthy and save you a lot of money, they're going to be like, yeah. Pass me my insurance card. But for this individual, it's going to be, this $5,000 is worth it because I'm getting a gynecologist or an obstetrician who's going to give me excellent care. If $5,000 is not enough, you can charge more. So the point is, instead of seeing 40 people at $140, you can see one person for $5,000. That's not the right ratio because there's a lot more involved, but you can probably see about 10 to 20 times less patients, have better outcomes, empower your patients, educate your patients, help them prevent chronic diseases at whatever your specialty is. And that is what is growing. And it's this tiny little niche that is growing within this community, and you can take advantage of that, meaning you can be in that space instead of being in this space. So those are my predictions of the future. I could totally be wrong, and all of a sudden, this is what could make this completely garbage, is if the politicians come together and say, we're spending a lot of money, our population is getting sicker, which means that we're going to have a lot lower productivity in the future. So let's do something good for these individuals. Let's lower the access, let's lower the barrier to good access of care. Let's give them the money to decide how they want to use that money for their care. Let's make it very transparent who's getting better care. Is it this mainstream insurance-based Medicare, Medi-Cal factory, or is it somebody who's going to a cash-based doctor? And let the consumer choose. I don't think that's going to happen. I've never seen the US all of a sudden turn and go in that direction. So for those reasons, consider where your career is going to be in the future, what's going to be sustainable in the future. Consider AI coming on the scene. And I don't think AI is going to make a big wave, by the way. It's going to be some slow, tedious process, just like the internet. The internet, everybody says the internet was a huge process. I was around for the internet. I was an adult when the internet wasn't there, and I was an adult when the internet came on. It was very gradual, it was very little, and not a whole lot changed. Instead of going to the library, you looked online. That was pretty much the gist of it. So understand that changes are coming, and you as a physician get to choose where you want to be. But you're not going to be able to choose it 10 years from now when that market is already saturated and when the options, or at least the barrier to entry, is going to be much, much greater. Building your online resume, building your reputation, getting those people to follow you, choosing that clinical side of what you want to do starts now with this group, and this group is rapidly growing. So that's all. I hope this is helpful to you guys. Email me, drmo@digitalnomadphysician.com. Take care.